Okay, so Cliff Wilming with We Do the Work. We are following up a story on the general cuts throughout the Fairview healthcare system that we covered a little bit before. We're talking about the cuts to Bethesda in hospital beds and in staffing, and the potential closure of St. Joseph's Hospital itself in downtown St. Paul, Minnesota.
Now we have a good idea of the trajectory of this story and how we want to cover it. We want to talk about the workers. We want to talk about their patients and their families. We want to talk about the administrators at Fairview Hospital Systems. We want to talk about the union itself, the Minnesota Nurses Association. And we want to talk about the government and their role in all of this. The problem that we're running into here is that with the potential closure of St. Joseph's Hospital, as well as the generalized cuts announced by Fairview CEO Jame Hereford, information is coming out too fast.
So in following this story, we've got a ton of comments from nurses, frontline healthcare workers, and we've also had some correspondence with some governmental officials in terms of what the potential remedy or demand is following these announcements by Jame Hereford. What have we learned? The first thing that we asked is, what is stopping the city government of St. Paul from enacting a law that would either create a moratorium on any hospital bed closures, and certainly the closure of healthcare facilities, or even ban the process outright and altogether? In other words, can local government simply write a law that says that you can't close a hospital due to public health needs? And we went and we talked to a city councilor there. I had many follow-up emails with Rebecca Noker, St. Paul City Councilor. And when I asked this question, her response after following up with the city attorney was confusing. So when I first asked the councilor, could St. Paul enact a law banning the closure of St. Joe's or restriction of healthcare facility beds, for example, I asked if the state law preempted the community from doing so. In other words, legal process known as state preemption that precludes local communities from enacting law that the state does not allow them to do. At first I was told that the city attorney of St. Paul said that this was not a preemption issue, but that the state and the local government simply did not have the authority. I probed further into this because I wanted to know exactly how that worked, and then I got another response that basically said that this actually was preempted by state law and that we could not enact a local law simply prohibiting Jame Hereford from closing down one of the most important hospitals in St. Paul. When I asked further clarification about what the St. Paul City Council was looking into, what I was told is that they are not looking into enacting any kind of law at the local level that would save St. Joseph's Hospital. In other words, this idea isn't even being explored right now.
So we're having to chase this idea of a very simple and potentially motivating fix that we could rally the community and the healthcare workers together such that it could potentially save St. Joseph's Hospital and reverse those bed closures at Bethesda Hospital and start to build that movement that we've been talking about. A movement that is able to take some community control over the fact that healthcare is a popular need and not simply a business decision levied by the CEO class of Jame Hereford.
There's more to this issue. Jame Hereford is also a champion, a disciple of a process that corporate America has enacted for factory workers, from Anderson Windows to Toyota vehicles, and all production facilities, called the lean process. Any healthcare worker knows what the lean process is right now. And what it is, it's a corporate attempt to streamline capacity to the point that you have supply and staffing that is redlined at the maximum efficiency. In other words, you do not have any additional supply, you do not have any surplus staff, so that you're operating with peak efficiency. What is the other side of the lean process question? What the lean process does is it restricts that kind of surplus or padding that we would normally experience both in materials and in staffing. Well, combined, the lean process, which allows for no surplus staffing or as little surplus staffing and material as possible, in addition to the idea that you have a CEO that is running with a mandate to create 20% closures across healthcare capacity in the Fairview healthcare system, what could these two elements do in a situation where we have a global pandemic?
Let's let that sink in a bit, because I can tell you that almost any ER person right now is probably pretty goddamn sick and tired of hearing the term coronavirus, due to the fact that we have an absolutely ass-handed response to it at the moment, and we get new information and sometimes contradictory information by the hour. Well, coronavirus, by any estimation, is at least extremely contagious and tends to give healthcare workers symptoms so severe such that it could potentially require hospitalization. So if in the hospital we have a lean process that's eliminating staff, that's minimizing staff availability and equipment, such as T95 respirators or hospital gowns or what have you, and then you compound that with a CEO that is looking to reduce the total amount of healthcare access in a major metropolitan area, let us ask, what is the net effect on public health? If the CEO, if the US capitalism-run, profit-seeking healthcare system has no answers to these sorts of things, what forces move in to take on these questions for the patients, their families, the healthcare workers, the communities, the workers in general? Where is that force? If it's not coming from city council, if it's not coming from the state government, where is it coming from?
I believe that the answer is going to come from workers. And I believe that it's going to come from the combination of workers uniting with the community and putting some answers out there and making some of the demands that perhaps the CEOs and the political class are a little less comfortable with than the idea that would be giving carte blanche to James Hereford in a time of global pandemic. This is Cliff Wilming. I am with We Do the Work. You are going to be hearing a whole lot more of this in the time to come. Again, thank you to all the workers that are reaching out with us. Big props to the families and the communities fighting there in St. Paul. Much love to all of us here, to you. Let's keep moving.
So go ahead and hit that subscribe button and hit the little bell so that you can get notifications for when we release new videos. Like this week, we'll be releasing an in-depth interview with We Do the Work's corporate correspondent Marilee Mazza on the lean process and the corporate healthcare model. And lastly, if you're a worker at one of these hospitals, or any hospital really, or any place of employment, and you have information that you feel like would be interesting to We Do the Work, or something that needs to get out there, that needs to be made public to the rest of us, you can reach us securely. You can contact us at our Gmail at contactwdtw@gmail.com. Reach out to us on Facebook. All of our sources are totally confidential, and we'll have a conversation and we'll get your story out there.